Good morning to our 40th edition of Global Healthcast, brought to you by Global Health Press. In this podcast series, once a week, we bring to you news and views about infectious diseases, vaccines, and vaccination. Today is June 6, 2023. I am Joe Schmitt, and with me is Dr. Melvin Sanicas. Today from Bangkok. Good morning to Thailand. Good morning, Melvin.
Good morning, Professor Schmitt in Italy. And hello to everyone watching us. Good morning, good afternoon, good evening, depending on where you are at the moment.
Also with us today is our publisher, Daniela Lamarca. It is my very high pleasure today to welcome Daniela. Good morning to Singapore. Good morning, Daniela.
Good morning to both of you and the rest who's watching us. Hello.
Thank you for joining us, and let's start with the program. COVID-19, depressive cognitive symptoms and brain inflammation, and Melvin will cover this. Pets transmit COVID-19 among each other, very interesting finding. Frequency of diseases and deaths in the United States. Most infectious diseases today, Melvin will cover SARS-CoV-1, the first SARS. And I will briefly, with one slide, cover investment and timing of vaccine development phases. Finally, we will have a note from our publisher, from Daniela, and that will be our last topic for today. Melvin, what is news about COVID-19 and depression?
So this is a study from Canada. It's a case control study published in JAMA Psychiatry. The team, led by researchers from the Canadian Centre for Addiction and Mental Health in Toronto, they actually use positron emission tomography, or PET, to compare levels of translocator protein. And this is a marker for gliosis, which is inflammation of the brain, in 20 participants with persistent symptoms of depression and cognitive impairment, with those of 20 healthy controls. So the study is not really big. The sample size is quite small, but it gives us an idea of the potential relationship between neuroinflammation and all these signs and symptoms that patients with depression are experiencing, especially those who had depression after a COVID infection.
Very interesting. So in the end, there is inflammation in the brain. The alternative hypothesis people are thinking about is that there is clotting due to thrombi, little thrombi that close little vessels, and then there is not enough oxygen, and that may cause these symptoms. So in the end, if there is inflammation and there is gliosis, the question is this a process that is limited, or does it go on? And in the end, your brain disappears and it's all fiber, right? That would be the worst possible outcome. So maybe we have to wait and see long-term results of such studies. Mm-hmm. Melvin, you have another topic, and that is on cats and COVID.
Yes, so this is pretty interesting, I think, because initially when COVID was still quite new 3 years ago, people were wondering whether this is a virus that can be transmitted in other mammals, right? And we know that it can be, like influenza. And now we know that cats can actually become infected with COVID through contact with other infected animals, including cats. And in this study, transmission of SARS-CoV-2 between cats is actually quite efficient and sustained. And now the question is, whether SARS-CoV-2 that is transmitted in cats could have their own mutations, could develop into something else, and might potentially be able to infect humans again. And I think the answer to that is it's possible, because we are seeing it now being transmitted within species of mammals and back to humans and vice versa.
So I guess in the end, we live with SARS-CoV-2 and we live with the SARS virus, and we're not alone. Our domestic animals will carry the virus as well, and there may be interesting interactions. So stay tuned for the future, right?
I think for me, what I'm thinking is because now we're seeing this in cats and dogs, right? In mammals. I think it will even make the situation more interesting if this happens in birds, because birds can travel further and can
Mm.
potentially do what it's doing to influenza with a bird flu.
Mhm. Very interesting. I have one very old study that I want to show you to do. Actually, it was published in 1953 and data were collected in 1948, 49, and 1950. And the American Army sent nurses to families once a week, and they were collecting information who in the family got sick and what was it and how long and all the details. So on average, we know from that study, you get sick 10 times a year, all minor illnesses included, a sore throat, a little diarrhea, a pain here and there, whatever. So from this total of 10 illnesses a year, the most common group of diseases is acute respiratory tract infections. And on average, humans are infected 6 times per year with a respiratory tract infection. The next most frequent group of diseases is diarrhea. And this is only a quarter of the acute respiratory tract infection. And this shows you a lot what we learned from COVID, right? The respiratory tract is the most important port of entry of pathogens to make humans sick. The problem from that is, or not the problem, what you have to remember is this is what you get sick from, but this is not what you die from. Unfortunately, such a study has never been done again, and this is the best data we have on that. And actually, I'm trying to set up something in the very near future to get a little bit more insights into this, to do something very similar using the internet. But in any event, this is diseases. Now, I brought this up because I read a paper on deaths in children under the age of 18 years from the United States, 1999 through 2020. And the alarming information is the most frequent cause of death in people under 8 is firearm-related injuries. This is unbelievable. And look how it went from 4.5 going up and down a little bit, and now it is 5.5, if I interpret this, or even 6 per 100,000. This is really something, and it is still quite rare compared to acute respiratory tract infections. But let's have a look a little bit. Other diseases are chronic respiratory diseases, fire or burns, heart disease, drowning, congenital anomalies, suffocation, drug overdose and poisoning, and malignant neoplasms. So I think this is quite interesting. The outcome here is the worst outcome that you can imagine, and this is why this is important. Whereas if you go to general infectious diseases, this is what costs a lot of money, right? We spend a lot of money on respiratory tract infections, some money on diarrhea, but very rarely young people die, and these are the causes of death in the United States. And I think this is an alarm sign. They have to do something about their firearm-related injury, and everybody knows what should be done, but it doesn't happen. Melvin, any thoughts from your side?
I think it's important for us to emphasize that this is a problem that's specific to the United States. And they're not the only country in the world with guns. They're not the only country in the world where people like guns. So for example, in Switzerland, almost every male person who is a Swiss who underwent training with the military actually keeps guns at home. So Swiss people have lots of guns, but we don't have these issues in Switzerland.
Yeah. Very interesting insight. I didn't know that, but you're right. You're right. Yeah. Melvin, you now cover SARS-CoV-1.
Yes. So for those who have been watching us for the past episodes, since Global Healthcast 33, we have been covering all these different infectious diseases. And the reason why they are here is because they're quite infectious and deadly and serious. And we don't have antivirals or vaccines for most of these viruses that are here. And so today we will be talking about SARS, and this is the first SARS. It's severe acute respiratory syndrome is the meaning of the acronym. It's a viral respiratory illness caused by this coronavirus called SARS-associated coronavirus, and it was first reported in Asia in February 2003. So almost, yeah, it's really 20 years ago. The illness spread to more than 24 countries in North America, in South America, in Europe, and in Asia. And before this global outbreak ended or was contained after a year, several people died. Thousands of people died from SARS, the first SARS. And then here on this slide, you will see some of the similarities and differences between SARS-1 and SARS-2. And when I say SARS-2, I talk about SARS-CoV-2 causing this COVID pandemic. You will see here that both of them use ACE2 as a receptor. Both of them also use TMPRSS2 as a co-receptor for binding. But it seems like for SARS-CoV-2, TMPRSS2 is used more. And then you see here that convalescent sera is actually more useful, was more useful in SARS-CoV-1 as compared to SARS-CoV-2. And the explanation for that is because the SARS-CoV-2 spread faster and mutated faster, and so it was not really comparing apples and oranges in terms of convalescent sera. But this is an interesting virus, right? This SARS-CoV-1, because just like SARS-CoV-2, it's an airborne virus. It can spread through small droplets of saliva, just like influenza. It was really the first severe and readily transmissible new disease in the 21st century. And it was also the first one in the 21st century to show a clear capacity to spread along international air travel routes. And I think if we as a global community really learned something from SARS, the first SARS, we could have managed SARS-CoV-2 better. But, you know, hindsight is always 2020. On the next slide, you will actually see the symptoms of SARS-1. So the incubation period is usually 2 to 7 days, but could be as long as 10 days. The symptoms are generally similar to other respiratory illnesses. So you have fever, which is often high, and sometimes it's associated with chills and rigors, and it may be accompanied by other symptoms, including headache, muscle pain. And at the onset of illness, some cases have mild respiratory symptoms. Typically, rash and neurologic or gastrointestinal findings are absent, although a few patients have reported diarrhea during the early febrile stage of infection. And on the next slide, you will see that there is no cure or vaccine for SARS, but this has actually disappeared. We have not seen this virus since 2004. So it's not a big problem at the moment, but with the increasing issues with climate change and with our, I mean, when I say our, human beings, with our interaction with animals more and more, with bats, maybe we could see it again in the future. And that's the reason why, even though it has disappeared, it's still in the list of WHO's important pathogens.
Very interesting. And actually, looking back, Melvin, 2002, we had SARS. 10 years later, approximately, there was MERS. And then 2019, there was SARS-CoV-2. So the rule is it will happen every 10 years, right? That would be the prediction, right? This is what we had. Yeah. Very interesting. I have a short piece of information that I found in the literature on the paper that here you see on the bottom is the vaccine development timelines and costs. And here, the preclinical phase, you see here you have a lot of vaccine candidates, right? And then by phase 1, most of them disappear. 52% disappear, 48% remain. And then it goes on like this. And in the end, in the phase 4, in the phase 3, which means until licensure, it is 58%. So I think this is really an interesting piece of information. And also you can see the expenditure that is needed here. I think this is a quite conservative number, and I'm not sure if this also includes investment into factories, into licensing. These are very expensive processes, and you need a lot of people globally to make sure that the vaccine can have and keep a license so that you can sell it at all. In any event, this process usually takes 5 to 10 years under normal circumstances. And certainly under emergency circumstances, you can speed it up by doing things in parallel, for example. One thing I also would like to highlight, vaccine production time. Vaccine production time for TBE vaccine, tick-borne encephalitis, that is 2 years. So if you need 1 million doses as soon as possible and you order them today, it will take 2 years before you have them. For pneumococcal conjugate vaccines, I know roughly it is 1 year. Again, this is quite something, right? And then for mRNA-based vaccines, production time is, let's say, 2 months. So you're much quicker with mRNA vaccines for various reasons. And I guess that is good news. And I also trust that more platforms will come up in the near future to speed up production time. If we can be shorter with development, I'm not sure. I think this may be a problem. In any event, Melvin, any thoughts from your side?
Yeah, I think we just need to share to people that one of the reasons why for flu vaccines, for example, right, it takes 6 to 8 months for the flu vaccines to be ready, and that's the reason why there is still some time for the virus to sort of mutate and change in the meantime, right? And so the value of new platforms like mRNA is really significant here, where you can potentially create flu vaccines in just a matter of 2 months.
I worry about this a little bit, and in the end, everything may be mRNA, right? And then you lose other platforms which you may need for other reasons, for very good other reasons. So, yeah, this is an interesting development. We will follow this. I think it's a good point for further discussions. Now, Daniela Lamarca is our publisher, and I'm happy she's joining us today because this is our 40th edition. And I think this is a great success. I was a little bit reluctant starting this with Melvin. Melvin kept me, along with it, and let's continue, let's start. And I'm, given my age, I'm a little bit more skeptical to new platforms and blogging. But number one, it's a lot of fun. Number two, we get a lot of good feedback. And number three, Melvin and Daniela, I think it is quite successful. Daniela, the floor is yours.
Yeah. Thank you for having me, and it gives me a chance to congratulate you to the success of the Global Health Press cast and the podcast. I just checked actually a few minutes ago. We have around 180,000 clicks now. That means on an average 3,000 to 7,000 per issue. And at that moment, I think I don't have to talk about all the many benefits that come with online publishing. However, since you asked me, I think I try to briefly talk about what comes to my mind about all the challenges that are coming with online publishing. For instance, the fact that the internet is overflowing with information, and the more you can be proud that you have so many clicks and that the Global Health Cast is so successful. And it can be difficult to distinguish reliable, accurate, high-quality content from unreliable sources. For that reason, it is crucial for publishers to implement strict quality control measures and establish a reputation for producing trustworthy material to maintain credibility and build trust with readers. In your case, this is all, of course, perfectly given. The abundance of digital information available online makes it often difficult for learners and readers to find relevant material. Therefore, to be found, and this is our job, effective search engine optimization techniques, metadata tagging, and proper categorization are necessary. And of course, as digital content is easier to copy and share, plagiarism and content theft become more relevant. Generally, authors and content creators must ensure that they have the necessary right and permission to publish and distribute the material without violating copyright laws. So taking care of each picture, each image, each source used for a presentation. And while digital publishing provides broad access to information, it also highlights the digital divide. We have to make sure, even if not everyone has the same access to the internet or the necessary devices, we have to optimize our content for different devices, as well as ensure compatibility with supporting technologies. And in general, for us, it's most important to have a robust technological infrastructure, because this is crucial. It's required for digital publishing, including servers, content management system, and file formats. There may be compatibility issues, Joe, you know what I'm talking about, due to different operating system, browsers, and devices. But ensuring a seamless user experience is essential. And last but not least, I want to emphasize that keeping up with new platform formats and standards can be quite exhausting, not to mention regulations. However, to remain relevant and accessible, we can't get around to adapt. We have to change and invest in ongoing technological upgrades. So this gives a short information what we are dealing with here, bringing Global Healthcast to readers, or keeping our idea website up to date.
Thank you, Daniela, and a big thank you to you as well for giving us the opportunity to by now have 40 editions in the past with no financial support, with no advertising. So thanks for helping us with this, and thanks for giving the information to our audience. I would like to conclude this topic on Global Healthcast with the next slide. Actually, you see here, this guy is calling for help because he needs emergency homeopathy. Homeopathy does not work, it is unscientific, and this is really something what we try to do, is giving you best insights, best advices, and I think it is worth doing it, and the number of clicks are a good support for us and show us that this type of information is needed. Melvin, any word from your side?
Yeah, so thank you, Daniela. We really appreciate all that you are doing for Global Healthcast in the background. And for the others, I just want to mention, because I know quite a number of people who are doing this, also doing podcasts, blogs, and really doing it professionally. And so
Exactly.
I just wanted to share to people out there that actually we are very happy, because getting even 100 views is actually not easy. There's so many videos out there being released on YouTube every day, and I searched for information in this, and apparently hundreds of thousands or even millions of new videos are going in YouTube every day, and to actually get noticed by at least 1,000 people is actually something, and we appreciate that.
I think almost 200,000 is a good number, and we are not K-pop stars. This is really useful medical information. So I'm very proud of you, and congratulations again. Thanks.
Thank you.
Thank you very much.
Thank you to the people who are watching us.
Yeah.
Thank you very much for these insights. And what we cover today is COVID-19 and COVID-19 that some parts of the long COVID syndrome may be due to brain inflammation. We showed you information that cats may transmit the COVID-19 virus among each other and also to humans. I showed you some data on frequency of diseases versus frequency of deaths in the United States. Melvin discussed most infectious diseases, SARS-CoV-1, and I guess the message is there may be outbreaks every 10 years. That's what we've seen now for the last decade since 2002. I brought some information on investment and timing of vaccine development phases. And finally, Daniela Lamarca gave us some insight as the publisher from our Global Healthcast. A big thank you to all of you for joining us for our 40th edition by now. This was our GHC podcast today, June 6, 2023. You will find today's slide presentation in our show notes. Please like, share, and leave your comments below. Thanks for joining us today. I am Joe Schmitt.
And I'm Melvin Sanicas. Thank you, everyone, and stay safe.
And I'm Daniela Lamarca. Thank you and bye.